CDC is rolling back several COVID-19 safety guidelines this morning because health experts say most Americans by this point have some level of immunity.
Channel 3 Eyewitness News reporter Roger Susanna now joins us live in Middletown with the details. And Roger, here in Connecticut, the first day of school is right around the corner. So a lot of parents are wondering how these changes are going to impact their kids.
Yeah, you're exactly right. And there is one way that's a pretty big change that's going to impact just about every student in Connecticut, and that is the fact that going forward, if a student comes in contact with somebody who's tested positive for COVID-19, they will not have to repeatedly test negative just to be able to return to the classroom. So that's a big change. But actually, a lot of these shifts are going to impact just about everyone. And another really big change that's going to impact schools and businesses and just general society is that going forward, the CDC is no longer going to suggest that people need to stay at least 6 feet away from one another. The era of prioritizing social distancing appears to be in our rearview mirror. Another big change is that if you are exposed to someone with COVID, you no longer have to self-isolate. Now you're just being told to wear a mask for 5 days around others and then take an at-home test on days 6 and 8, and if you test negative, you're good to go. Now, no matter what you think of these changes, the reason behind them is actually tied to a very positive development. Researchers have found that about 95% of adults have some level of COVID immunity, either from vaccines or from being infected. As a result, the CDC feels pretty comfortable rolling back these restrictions. CBS chief medical correspondent Dr. John LaPook says that experts want to clarify what's important as we enter a new phase of this pandemic.
The CDC is trying to consolidate and simplify its guidance and remind us the pandemic is not over and a lot more people still need to get boosted.
And Dr. LaPook says one of the primary focuses right now is on protecting big groups of people who may be at risk, people like patients at hospitals as well as residents at nursing homes. But he also stresses that this pandemic is far from finished. As an example of that, keep in mind here in Connecticut, our positivity rate is still above 12%, so we still should stay vigilant. Reporting live in Middletown this morning, I'm Roger Susanna, Channel 3 Eyewitness News.
All right.